Hello, my name is Martine. Welcome to my fifth video blog on MS. I was just going through my medical record that I got from BlackRock and examining it in some detail. Now, I didn't fancy doing this at first, but it's become interesting and it's revealed a lot of why stuff is wrong with me, and kind of comforting in that way too. So I'll just get that sheet, that relevant sheet that the neurologist scribbled loads of notes on. I'll show it to you and you'll see exactly how I had difficulty trying to decipher it, but I have deciphered it. Now I'll start off by discussing the MRI report. It states no intracranial mass or mass effect. That means no brain tumour. No acute intracranial hemorrhage, no hemosiderin deposition. That means no brain bleed of any kind. There are periventricular deep white matter signal changes with multiple focal subcentimeter lesions adjacent to the ventricles. The orientation is somewhat perpendicular in manner. That means there are white matter lesions that are called Dawson's fingers in parlance, in MS parlance. They're called Dawson's fingers, and they are one of the characteristics. About 80% of people with MS will have these. So then no restricted diffusion. That means it's not of ischemic origin. In other words, it's not due to blood vessels problems there. Corpus callosum appears normal, brainstem and proximal cervical cord appear normal, pituitary and suprasellar region normal, intracranial vessels which are normal, signal void, mastoid air cells and facial sinuses clear. So impression, periventricular deep white matter, signal changes and lesions are orientated perpendicular to the ventricles and appear more confluent in the right centrum semiovale. Appearance may reflect demyelinating changes in the clinical context. Vasculitic or ischemic changes could give these impressions, suggest correlation with other clinical parameters, plus or minus interval follow up MRI to assess for any progressive change. Now, this is the neurologist, the visiting neurologist to BlackRock Clinic. That's her report, scribbled out. It's hard to read, but I got to decipher it one way or the other. And the thrust of it is that she thinks it's probable MS, but it has to be followed up by more MRIs. She questions, is it vasculitis? And one reason for that is because from an old pathology report, I got a weak ANCA, perinuclear ANCA positive. So that finding is common in vasculitis. It's universal in vasculitis, but it's also found in people who have had colitis. So in my case, that's where it'll have come from. If I had vasculitis, I'd be having skin problems, I'd be having kidney, lung, everything, it wouldn't just be in my brain. So then the neurologist's scribblings describe how I have an ataxic gait. That means I don't really have good balance per se. It's an unsteady gait. She then suggests also it could be CIPD, except she kind of then goes on to eliminate that out of the question, because I got had symptoms before ever I got any COVID vaccination. Apparently neurologists are finding that CIPD, that's another demyelinating disease, has been occurring in some patients who have received COVID vaccinations, so especially boosters. So that's why she brought it into consideration. But the funny thing is, looking at one of my reports there, it suggests I have had a colostomy. I have had an ileostomy, and it suggests I had a right colectomy and that I still, a left colectomy, and that I still have the right side of my colon left. Well, that person needs their eyesight examined, I suggest, anyway. One good thing my GP did was to put me on escitalopram and take me off citalopram. Escitalopram is a more effective antidepressant with the ingredient that causes side effects taken out, so that it's much, you can prescribe it at higher doses with less side effects. So it's really, really effective, and I am definitely finding some of the benefits already from that, even though it's only a few days. It's definitely, I feel rather a lot more relaxed having started taking it. Now I'll give you an example of how I am walking at the moment. I'm a little bit unsteady, but I don't need a stick when I'm in the house. So you'll just see a little bit ataxic. So I'm not quite as smooth and fast as I used to be, but here we are. And just to note, the lesions which are described in the report are actually in locations which control movement, and so that's why I feel a little bit more restricted in movement and uncertain, because that's the little white projections are interrupting the signals circulating around that area of my brain, which translate to the spine and to movement of the limbs. So it's a little bit getting in the way of the signals going through. So that explains it for me. In fact, it's a bit of a comfort to know exactly why things are happening. That's why I like to study stuff. So I'll see you in another video log, and bye for now.